And yes, during this show, you will learn the most important life-saving technique you will ever need to know. This is the Real Nurses Talk Show. Now let's get started.
Sunshine, gonna make your day. Sunshine, gonna make your day. Sunshine, gonna make your day.
Many people do not know that heart attack is the #2 cause of death for women in America. The information our guests are going to share here today could save the life of someone you love. We have Dale. Dale is a returning guest. You may remember him from our blood transfusion show. And Dale, we already know your background right now. Your specialty, current one?
Intensive care.
Intensive care unit, medical ICU at the local hospital, we shall not name. And also, you came down to Washington to be with us, right, Annie?
Yes.
And you've been a nurse for how long now?
Oh, quite a few years.
Yeah. And you've worked in different specialties?
Yes, intensive care unit.
Yeah.
Cardio surgery, yes.
Oh, awesome, awesome.
Yeah.
So you guys are pretty much have been exposed to a lot of patients with myocardial infarctions. Yeah, so you'd be the ideal ones to talk to today then. So I was going to ask you, Dale, what are the typical signs of a heart attack?
The typical signs we hear about it are not quite what we see on TV. The typical signs are actually a beginning of chest pains or pressure in the chest, not always sharp or disturbing like that or sudden, but they come on quickly and they crush, and that's one of the major
So like crushing
symptoms.
chest pain?
Very much so. You feel like you have an elephant on your chest is what's been described, and it's difficult to get your breath. So that's the #1 obvious symptom that you have.
And that's the primary reason people will come in.
Yeah, you just feel crummy.
So do you find that women present with those same type of symptoms?
Absolutely. It is
Okay.
more intense than it was, wow, 20 years ago. Very intense.
It seems like women are having more and more.
Absolutely.
Yeah, I
yes.
found it really interesting though that after cancer, heart attack is actually the #2 cause of death in women, and people are not even aware that women are such a high risk population for this, right? So there are many factors that would contribute to a heart attack. Could we just go over a little bit so that our audience could learn from your knowledge?
One of the things we talk about oftentimes is diet, and with diet comes a sedentary lifestyle. They oftentimes go together. So it's if you eat a diet in high cholesterol and fats and things like that, saturated fat, not even saturated, but just fats, and then you couple that with even today's society is more and more we're sedentary. Instead of doing a lot of walking, we do a lot of computer work and things like that. So those are two.
And we drive a lot.
Exactly, and those are the day-to-day issues.
Absolutely.
The outliers and the other things are like the group that's being from an ex-smoker, I can say the smokers because we're smokers.
Right.
And those are higher risk as well.
Yes.
Speaking of smoking, that would be a contributing factor, correct?
Absolutely.
So is that why you stopped?
That is why I stopped.
Or is that the reason we're going to give the audience why you stopped?
The reason why I stopped smoking is after 34 years in the intensive care unit, the single worst possible thing you can do for yourself in every system of your body is smoking. Could I pick up a cigarette tomorrow? Absolutely I could. I'm an ex-smoker, but it's the single worst thing you can do for yourself in terms of your heart health.
Your
number
heart
one.
health, right?
And another area as far as dieting, it's exercise. It is so true. We have the computers now, and we are at the desk.
Right.
Not only in the hospital, just on an everyday basis, even in the home structure.
Right, right.
So it's best to get out and walk and exercise,
Absolutely.
or
Get up
join
and
one of
walk.
the, YMCA, or any of those.
Try to actually go touch the buttons on the
Absolutely,
TV.
yeah.
I don't know the last time I did that.
Right, right.
Yeah.
So yes, there's many ways of increase, you know, making the heart much better is exercise.
Absolutely. And is this the hereditary as well?
And that is one of the things when we talk about hereditary issues, is that once you know that, if you know that or find that out when your first blood test and your cholesterol is high, you realize that you're at even a higher risk factor. So now I've inherited some of these from my father, thank you very much, and along with other few bad habits. And so now it's up to me even more to exercise more and things like that.
And it's, in a way, it's kind of good to know your familiar history, because then you know the things that you're predisposed to, and you can do a preemptive strike. You know, you quit smoking, you increase your activity, and you eat healthy so that your diet, so you lower your cholesterol. I know we've been talking heart attack, I've mentioned myocardial infarction. It comes with many names, doesn't it?
Very much, yeah, indeed.
But what exactly is it? What happens to your body when you're having one?
When you're having a myocardial infarction, the myocardium means the heart, infarction means the stoppage of blood flow to there. So, so you have basically, just as you would tie a rubber band around the tip of your finger, that tissue would die, and so does the tissue in the heart.
So it just cuts off blood from that area.
Exactly. And so that area of the heart is dead and turns to a scar.
Wow. So, and that's what we call heart attack, right? That's when you get that crushing symptom, because it's your heart saying, I'm not getting enough oxygen, I'm dying out. Okay. So, do you find that people coming with chest pains, but they're not really having heart attacks? Does that ever happen? Do you see them in the ICU at all?
We see it. We see it from the emergency perspective when they come in. A lot of times, they'll come in with everything from gallbladder pain, which also mimics, if you've ever had a gallbladder attack, it mimics heart. It's horrible. It's a horrible feeling. You can have pleurisy from like a pneumonia or a cold, or blood clots to your lung, what we call pulmonary embolism. So there are many different things that can cause that. My son right now is a swimmer. He's going through chest pain because he's learning the butterfly. So because of the butterfly,
because of the motion of
exactly.
doing that?
So he has chest pain in his chest.
Interesting. So, so someone came in and we wanted to differentiate between, you know, say pleurisy or the gallbladder-related pain and actual heart attack. What kind of diagnostic tests would we be doing for this patient?
Well, that would be the, I would say like the EKG, and they will place it under the structure of the heart area here, and that is one way of determining also.
So we're looking for changes in the rhythm.
In the rhythm of
Right. And that's going to tell us like what area of the heart is affected, if it is?
Yes.
Okay. And what about lab work?
Yeah, along with the presentation and then the 12-lead EKG. And the lab work has changed quite a bit in 30 years, hasn't it? We started with these basic things. And
CBC and the CAM7, so, but now it's, I understand there's more.
You're doing troponins, you're doing
we jump right to the troponin. And some of these myoglobins, we
don't understand why some hospitals, that's what they do.
Yeah,
and then you go to other places, troponin is the gold standard, you know, that they use.
And then if you're thinking maybe it happened 2 days ago, the creatinine phosphokinase. So there's several different ones that have evolved over the last 30 years that are becoming more and more specific and sensitive in time.
And more studies, the more studies we do, the more we learn about more sensitive markers, right? We call this markers, right?
Cardiac markers.
So we've gone a little bit over the signs and symptoms. We talked about the crushing chest pain. Is there a particular way a person would look? You know, the pale skin, the clamminess, you know, when they're having chest pain and stuff like that. That's almost, you can almost look at, I guess we've been doing this a while, you can almost look at the patient and go, okay, I know you're having a heart attack like right now.
Exactly. Yeah, very much so.
Yeah.
And sometimes it's just nuances. When I'm on the rapid response team at a hospital and a patient says, I'm having a sharp, sudden pain here, that's nearly 100% not a heart attack.
That's right.
When they're going like this, they're going, oh, you know, this feels bad. Then I get much, much more worried.
Right.
Then like that. So it's kind of a feel.
Those little nuances. Absolutely. So do we have gold standards and treatment options? What are the treatment options then? hopefully not me. Somebody comes in and we diagnose that, okay, this person is positive for a myocardial infarction. What are we going to do for them now? Is there a time limit? If they were doing it from home and they're getting here, is there a specific time period between when they get to our emergency room and when we have to like absolutely do something to reverse that action?
There is what they call the gold standard of door to cath lab,
Right.
and generally no longer than 60 minutes from the time a patient gets in the door. We
Right.
take the EKG, and now actually there's many ambulance crews that are carrying 12-lead EKG machines, so
Oh, that's
they know
awesome.
before they ever get.
If this
And,
person.
and some places they're actually talking about thrombolytic therapy in the ambulance based on EKG. So they're really going out there, but
Wow.
the 12 lead is like, how
The
fast can we
12
get them to the cath lab?
Right.
And that's a place where we can open up that blockage to
Because
get that
the
blood flow.
idea is to get blood to the
Yes.
heart.
That's
And
number one priority.
number one
Mhm.
priority.
Right.
Yep.
Yes. So are there any medications we'll give for thrombolytic therapy being what we call clot busters? Specific, not your regular blood thinners, but specific medications that will give you to go in and bust clots in your body. So that's one type. What other kind of medications will we give them? Like nitro. I'm sure a lot of people are familiar with nitroglycerin. Yeah.
Right.
Yeah.
And nitroglycerin helps to open up
Yep,
the
that
blood
helps.
flow into the heart. We also give things called beta blockers, or I think they have the names are metoprolol.
Oh,
And what
yeah,
that
metoprolol,
blocks
yes.
adrenaline to the heart and opens,
Yes,
relaxes the
relaxes
heart,
it.
so it's not using more oxygen than we can get to it.
Right.
So
right.
those are the things we will give that, and an aspirin. Aspirin
Yeah.
is vitally important.
It's so right.
A simple
right.
aspirin.
And,
It's
Just a simple
and some
Bayer
people take
aspirin.
just
Baby
right
aspirin
a baby
still.
aspirin
Yes,
to people
it's
take
not-
at home to help prevent
Absolutely.
that. Yeah.
Mm-hmm.
So and surgical interventions. I guess if you, not I guess, when we take you to the cath lab and we get there, we go, oh, this person needs surgery. So that's one option, right?
It is. Generally speaking, they'll do the balloon. They'll put a
And the angioplasty.
balloon and angio or stent. And if they can't, if that's something that's not working, or usually it's a short term, they'll stent it long enough and then say you need surgery
That's
Right.
what they
tonight
do.
or tomorrow. or-
Yeah.
Right,
'Cause to
right.
prevent from doing actually the surgery, they would refer to do the cath.
Right. We'd
Yes.
rather do something that's not quite as
Yes,
invasive.
absolutely.
Although open heart surgery is not what it used to be.
Much
remember-
different now, even better.
Yeah,
Yeah,
w-
much
much
better.
and it seems even less barbaric almost, if I may
Yes.
say so.
That's a good
But-
word.
Very
We
good.
used to have incisions like from here all the way down and from your leg all the way down.
Yeah.
And now you have like little strips
Strips.
of
Literally. Yep.
literally
Yep.
on your legs. It's just incredible.
Absolutely.
So heart attacks are preventable, right?
They are, and that's what's sad about heart attack is that
Mm-hmm.
so many of them are preventable or something that can be delayed
Yeah.
with just simple diet,
Mm-hmm.
exercise, not smoking, and things like that. So
Yeah. So
It's-
if you were dieting and exercising and not smoking and stuff, then your risk of heart attacks goes significantly lower, right?
indeed,
Yes.
yeah. Yeah, and I describe that to patients all the time. If you've ever looked at a sewer pipe that's got low flow, it's got junk in there. But if you look at a pipe that's got a very high flow, the junk is very low. And that's
Right.
the same thing within the cardiac vessels.
And that's such a perfect way to describe it. It is like a pump, you know. So you have those pipes that are there, and you don't want to clog the pipes,
Exactly.
you know. And our clot busters are like Drano, you
Very
know.
much so.
You just put it down,
Bang, there it is.
yeah, and get rid of it.
Yes.
So, in the event of a heart attack, someone stops and drops dead in front of you or collapses, and you can tell that something is terribly wrong. They don't have a what should they do if you're at home and something like that happens? What should you do for this person? What would you suggest?
Get the tools to help. So call 911. So
Absolutely.
they will be on
Yes.
their way.
Yes.
So you don't get tired out, and
Right.
they have all of the medications and equipment to further resuscitate the patient.
I'm a big
Or
person on demonstrating.
911.
So if you were doing CPR, where would you
Yeah.
put your hands and what would you do?
So we find basically for bystander CPR, it's right in the middle of
Right
the
here.
chest. Don't get fancy. You don't have to worry about what you saw on the TV show last night.
Right.
Go right in the middle where you think the middle of the chest is, and it's helpful to open the shirt. As tough as that sounds sometimes.
Right.
Get in the middle.
Right.
Get it right in the middle.
Yeah, just
Right.
get right there.
We used to have this fancy, you do this and you do this, you just go right in the middle.
Right in the
And one thing I love about the American Heart Association is that they are pushing the hands-only CPR, because so many people are really, really afraid to do CPR, especially the mouth-to-mouth part, breathing for somebody else, or they're thinking, oh, maybe we'll do something wrong. But that little action that you can do for that person could truly, truly save a life.
If you see a teen or adult suddenly collapse, it's important to act fast. Helping to save a life is easier than you might think. Just start hands-only CPR. The first step is to send someone to call 911 or call 911 yourself. Then get directly over the victim. Put the heel of one hand in the center of the chest. Then put your other hand on top of the first. Then push hard and fast in the center of the chest until help arrives. It's important to push at a rate of at least 100 beats per minute, which is about the same tempo as the song Stayin' Alive. Let's hope you never have to use hands-only CPR, but if you see a teen or adult suddenly collapse, don't be afraid to try it. Remember, call 911, then push hard and fast in the center of the chest until help arrives. Your actions can help save a life. To learn more, call 877-AHA-4CPR or visit heart.org/hands-only-CPR.
So we want you to get up there, we want you to do some CPR on this person, and we want you counting to staying alive. I usually say 1,000, 2,000, 3,000.
I was doing it too. I was trying to think from an older population how you would do that because they don't know Staying Alive. So I YouTubed In the Mood by Glenn Miller. And if you do it on the downbeat, it works just fine.
It does.
So, yeah. So if you do In the Mood.
I don't even know what song he's referring to.
It's a great song. In fact, I'm going to try it next time.
Oh my.
But the most important thing, I had a great nursing supervisor once who told me, because I told her the very first time I said, I'm so scared I'm going to do the wrong thing. And she looked at me and she said, there's nothing wrong you can do here. This person is at their most vulnerable ever in their so the worst thing you could do is do nothing.
Right.
So give it your best shot. Right in the middle of the chest. Push as hard as you can. For most people, that's not going to be dangerous. Don't worry what you feel. It's not going to be comfortable to you. What you feel, just do that for that person.
Do something.
Once you establish they need it, then just do it.
Right. So there's different types of things that when your heart is not getting enough blood flow, it obviously, since we monitor the heart with EKG rhythms, strips and stuff like that, so obviously there's some changes in your electrical action of your heart, since there are areas it cannot go to anymore because of all the damage that's been done.
Right.
So this would lead to like different types of what we call arrhythmias, which is irregular heartbeats basically. So there are certain types we call lethal arrhythmias, and these are the kinds that will cause things like heart attack and cause you to, pretty much just drop. I keep saying drop dead because I think that's what happened to my parents. But I'm so sorry, guys. It's my way of coping with it, so pardon me.
It's definitive.
I should sue my mommy. But anyway, so we have things like defibrillation, where your heart is just, the ventricles of your heart is just shaking, as opposed to being locked up, like this. So what other kinds of rhythms are you aware of, and how do we address this? Because obviously we'll have to do something about it, right?
You do, and the interesting point about this is a few people, especially nowadays, die of pump failure from a heart attack is from these lethal dysrhythmias.
Right.
And the best thing to do about that, number one, is CPR. Number two, we use electricity, and the electricity is the way to get them back
get
into
it back
normal.
jump started.
Right,
Exactly. If you think of
absolutely.
basically, this is nothing more than if you hear about a person having a seizure of the brain, this
Right.
is a seizure of the heart.
Right.
And you want to get that back into normal
I
again.
like the way you put the seizure of the heart.
That's exactly. And so with the electricity, oftentimes it just takes one or
Little
two.
bit.
The longer you
Yeah.
go without CPR and the longer the arrhythmia happens, it's harder to get a person out. That's why we tell folks, do this CPR. Make sure the heart is ready for the electricity when we get there with it.
Right, right.
So-
And even you could be at an airport, you could be at a shopping mall. I was actually at a shopping center the other day, just at the local place, and they had an AED hanging on the wall.
Oh,
Tear open foil package across dotted line and remove pads. Next, separate one of the white pads completely from blue plastic liner. Begin peeling from the tabbed corner. Firmly place the pad without the liner on the patient exactly as illustrated. This pad can be placed on either of the two locations shown. Next, peel the blue plastic liner off of the second white pad. Firmly place the second pad on the opposite location exactly as illustrated. Do not touch patient. Analyzing heart rhythm. Please wait.
If a shock is advised, the voice prompt will say,
Preparing shock. Move away from the patient. Shock will be delivered in 3, 2, 1. Shock delivered.
It is important to note that the PowerHeart AED G3 Plus has been designed to only deliver a shock when one is needed. You cannot accidentally shock someone.
So don't be afraid of those machines. They walk you through everything. Just try to do something. If you can't think of anything else, just
do the regular
CPR.
procedure.
Essentially, when this does happen, that person pretty much died and we brought them back, right?
Exactly.
That begs my other question. Have you ever known anybody to say they had like a near-death experience, or they had that floating sensation we see in movies where people can look down and see people working on them? Have you guys ever heard of anything
Years
like that?
ago, we did have, in fact, she was a young lady, 29 years old. And we're looking at the 70s. And she actually did say that. She could hear the conversation and everything.
Oh
So,
my goodness, that would be so surreal.
she was just in the room there and had that life and death experience. She didn't go nowhere. She just stayed there
Just
in
watching
the room.
everybody.
Yeah.
Interesting.
And so,
And same. I've heard a couple of folks say that they
Yeah.
have been, that they have
They left
also
their
been in the
body.
room, kind of looking down, watching what's going on.
yeah.
Oh my God.
Yeah.
Absolutely.
You know, the funniest thing is I've been doing this a long time, and I honestly have not had a patient say that ever.
Not yet.
But,
Oh.
so I always used to think, yeah, you know, that's Hollywood for you. I'm making that up. There is a video that we're going to show you about someone who's had experienced this and experienced a myocardial infarction, had an afterlife experience from what they said. And how this has changed their life for the better, actually. Because when you have a very traumatic incident like that happen to you, it pretty much forces you to reevaluate a lot of things.
Clear? Clear?
I felt like I was fading away. Next thing I knew, I was looking down the room where my body was. I could see everyone working on me. I could hear what they were saying. There were two nurses outside of the room looking in. One said to the other, "Why are they working so hard? He's gone. If they do bring him back, he'd be a vegetable." I later on told her what she said. She about passed out. Then I thought to myself, "Where's Debbie?" And instantly I was in the room where she was.
And I'd just gotten finished with that prayer. You know, He's yours, Lord, because I knew that that was the only way He was coming back to us. If God wanted Him to.
When she did that,
It's yours.
I zoomed right in on her face.
It's yours.
When I saw her face, I saw every aspect of our life together. From the first day we met, our marriage, the birth of our children, all the emotions we've shared. I couldn't leave her. I just couldn't leave her. And I cried out to the Lord. I said, Lord, I love you so much, but please let me go back. I said, my wife needs me. My children need me so much. Please let me go back.
The doctors and nurses didn't give up. They shocked Jim so many times that the flesh on his chest was burned. Then, the doctors heard a heartbeat.
I came back to a world of pain. They shocked me so many times. It's like coming back out of the water. Just my hearing came back. I could hear them telling me, I can't believe it, he's back, he's back. I said, can you hear me? And I took that first breath on my own. Have you ever tasted honeysuckle? That's exactly what that first breath tasted like. It was so sweet, so wonderful, and I just thanked the Lord.
Jim was alive, but his heart still wasn't functioning properly.
They put him into a coma, a Medicaid coma, and to allow his body to heal. So I wasn't able to talk to him for days.
Jim spent the next 17 days in intensive care.
So if someone was thinking about going into nursing practice, what pearls of wisdom do you nurses have? You've been nurses for a very long time, so.
I would say it's a very good field to go into. Very educational. You learn so much about the human body as well as with the doctors. And I just love it. It's a very exciting field to go into.
Right.
Yes.
And there's a diversity that I love about it.
Yes.
Yeah.
And to go into it listening and try not to pigeonhole every patient into it. Right. If a patient says they take their medicine at 10 p.m., don't try and give it to them at 8. No matter what they say. So nursing is realism.
Right.
It's always realism.
So
and always try to bring that realism within the standards that you have to uphold.
Absolutely. Absolutely. Those are really great advice, guys. Thank you. If a viewer was at home watching this, what should they take away from this discussion we just had on heart attacks?
And be sure and call 911.
Right.
Yes.
Yep. And prevent. Always prevent. You can always be successful if you try to prevent. We cannot always be successful in the treatment. Once it happens.
Exactly.
In some fashion, you can be successful.
And I will have to say, I'll bring this back. I just wanted you all to know, CPR, hands only. Don't be scared. Jump right in there and please save a life. Make it a point. Thank you. My name is Sonia Justice, and I was here with Dale and Annie, and they've been educating you on heart attacks, myocardial infarctions, and everything that can go wrong with your heart. We shall see you next time. Bye-bye.